Well, October is Breast Cancer Awareness Month. Now, beyond simply being aware of breast cancer, it's also a good time to focus on prevention and early detection. And with more information on how to do just that and more is Dr. Christine Salter. Thanks so much for being with us today.
I'm happy to be here.
Okay, now you're going to tell us something that a lot of women are going to, because earlier talking to you, I was like, wow, you're blowing my mind. We're all told to get mammograms, mammography screenings. We have vans that go around, and we feel like if we get that mammogram and it shows nothing to worry about, that we're good. What's wrong with that?
The problem is, individually, if you've got dense breasts, the mammography is not as sensitive. And often the report will say that. It'll say, maybe 30%, 20% decreased sensitivity if the breasts are dense. That means they could have missed a lesion. But even more than that, two large studies have been published in the British Medical Journal, New England Journal of Medicine, 50,000 women, and what they found that with screening mammography, that it actually doesn't save lives, and that women are dying at the same rate, whether those women between 40 and 59, that's the common age for the screening, they're down at the same rate as women who don't have screening mammography. So basically, there's more to it to prevent breast cancer.
Now, when you say screening mammography, is there another kind of mammography?
Oh, yes. So there's diagnostic mammography. So that means, we're now looking for something. So maybe there was a lump, breast feels a little different, and so now we're doing more. We do ultrasound, and diagnostic is much more detailed than the two-shot from screening.
Now you have something, it's interesting because I don't hear this particular aspect talked about a lot. We talk about, how to get the mammogram once a year, but we rarely hear anybody talking about possible ways to prevent breast cancer or things that we could do in our lives that can lower our chances. And you have kind of a little program you call Stop It. What is it? What does that stand for?
So Stop It means, well, we want to stop the breast cancer before it even starts. And the studies show that 40% of breast cancer can be prevented by lifestyle. So that's where the Stop It came along. So Stop It, S is for sleep deprivation, not getting enough sleep. The T is for toxins, and that's toxic emotions, toxins in our personal care products, dry cleaning products. The O is oxidative stress. A lot of these things cause oxidative stress, then can trigger abnormal cells. The P is for physical inactivity. What we know is that exercise both treats and prevents breast cancer. So a woman with a breast cancer, if she exercises regularly, she's actually treating the breast cancer like she was taking a medicine.
Wow.
Okay, and the I is inflammation. A lot of these things, the sleep deprivation, the toxins, they cause inflammation in the body. And we know that chronic inflammation drives disease. In the acute setting, we want that because it's a good thing, but in the chronic setting, we don't. Okay, and the T is targeted, a targeted workup. So we look at all those biomarkers, we look for all those things, and then make those changes individually for the women.
One of the things you mentioned, backing up a few letters, was toxins and chemicals. Now, a few years ago, I talked to a woman from the Safe Cosmetics organization who was talking about how women use 10 to 15 products a day: hairspray, makeup, deodorants, creams, lotions, and all of those, not all, but many of those things contain carcinogens, which the manufacturers do not deny, but they just say trace amounts, just trace amounts, but trace amounts of stuff you're using every single day. So how much of a role does that play in your opinion?
It's huge. I tell my patient what goes on goes in. Transdermal hormones, we put on transdermal, it gets into the system, doesn't it? That's how it works. If women having hot flashes, whatever we put on is going in. Face, it doesn't matter where it is. So we have to be very cautious about what we use. We've got to make really good choices of what we're putting on because it's going to come into us. And it depends on how much. When we've got a great liver that will detoxify, but you start doing day in, day out, several times a day, it's going to overwhelm the system. We're going to get oxidative stress. We're going to get chronic inflammation. We're going to get direct activation of the cells.
So certainly a lot of things that people should think about, women should think about on a daily basis of what they're applying. But also, what are you drinking your daily cup of coffee out of?
Right. Styrofoam cups. The styrene is carcinogen. Grilled chicken, grilled meat, carcinogens. Go to the dry cleaner. and we put on our clothes, carcinogens. So we have to be mindful about everything that we're doing. We don't want to stress ourselves out, because so much stress, then that's also inflammatory. So we want to be mindful and just make good choices. There are a lot of things out there that we can do things safely. You know, the Environmental Working Group, ewg.org, they're a huge resource for cosmetics, for things we eat. I mean, you know, the organic foods, you know, the Dirty Dozen, the Clean 15, they'll tell you which foods and which fruit and vegetables to buy organically and which ones you can buy non-organically. So then we can just be mindful about that.
And it really does seem, with so many of the illnesses that we have, modern day illnesses, simple things like getting more sleep and eating healthy and exercise is almost, you know, really, is it that simple? No, it can't be that simple.
Right, and really it is that simple. Just not getting enough sleep increases the risk for breast cancer, it increases the risk for diabetes, depression, hormone imbalance. You know, everyone wants their hormones balanced. One of the best things you can do is get enough sleep.
Now, we talked about the mammogram, but what would you recommend people do? I know you do, is it thermal imaging that you do at your practice?
I actually do thermal imaging, and that's a functional approach. So just like, we don't want to just take one thing and say, okay, my thermal is normal, everything's great. My mammogram is normal, everything's great. We have to look at it in a comprehensive way, look at everything.
Now, I know that you have a lot of information on your website too, so for people who've been listening to this and are like, wait, what is she talking about? So we would definitely encourage people to contact you and look at your website, which is drsalter.com.
drsalter.com. I've got a whole section on breast health, and they can join our email list. We'd be very excited to send things out for them.
Well, thank you so much for joining us.
Thank you. This has been great.